Foundation board members, my fellow award recipients, and the many distinguished guests that are with us this evening. My first step into the world of infectious diseases came before I was born. My parents lived in a brick ranch style house across from Mr. Bentley's peach orchard in a small town of about 700 people in rural Kentucky. Many of my childhood memories are just a blur. Walking down what we called the dusty road to my grandparents' farm, or sticky hands from eating peaches that we picked from the orchard. But one memory is perfectly clear. That sunny, cool spring day when my dad told me the story of an illness that happened 2 years before my birth. He had a big, thick chest x-ray film, and he showed me a scar on his lung, and he told me about a germ that was asleep in that scar, and that germ could wake up at any time and make him cough and be spread to my siblings and me. It was tuberculosis. But we were the lucky ones. Just a decade earlier, several new antimicrobials had been approved to treat TB, and they stopped my dad's greatest fear straight in its tracks. That was over 50 years ago, and yet we still have 1.5 million deaths from TB every year. That's the number of deaths we just reached globally for COVID this week, but that happens every year. In what remained a consistent theme of nerdiness throughout my life, I spent hours looking for pictures of bacteria and their organelles. I would enlarge the images with a projector that I got from my mother's Sunday school classroom, and I would project them on the wall and trace them with art paper. How could these teeny tiny things take down a grown-up? Well, the hours spent staring at bacteria projected onto the wall of a church wasn't an obvious way for kids my age to get friends, but it was the spark that led me here tonight to be with you, many dear friends who may also share my nerdiness. My fascination with bacteria eventually led me to the Centers for Disease Control, where I joined the Epidemic Intelligence Service Office. Now, being the part of the foodborne and diarrheal diseases branch, it may not be everyone's Sunday picnic, but for me, it was heaven. Real shoe leather epidemiology. I got to investigate outbreaks and learn alongside the most amazing colleagues, many of whom are with us tonight and still lifelong friends. But what troubles me to this day is the work that I did as an EIS officer in Kenya. From 97 to 99, I worked in Kisumu to support an ongoing surveillance study of diarrheal diseases in infants born to HIV-infected mothers. It was the peak of the HIV epidemic in sub-Saharan Africa then, just before antiretrovirals were introduced. After 2 years of a cohort of about 400 infants, 52 had died. That's 1 in 8, half from pneumonia and half from diarrheal disease. My EIS training had taught me that outbreaks, epidemics, pandemics, they're never caused by a single event. Rather, they result from multiple breakdowns in the system. The enteric pathogens, they weren't the only reason for these diarrheal disease deaths. It was that collision between those pathogens, this other virus that was raging and attacking their immune systems, and the fact that these infants just happened to be born in a village that was really poor. When poverty and pathogens when they join forces, we have to fight back with partnership, with cross-disciplinary collaboration, with public and private sectors that join forces. Although we didn't have microbiologic data to support what these enteric pathogens were that claimed these lives, we knew from other epidemiologic studies that at least half of them were caused by rotavirus. It's yet another RNA virus that has a spike protein that looks really similar to the red spikes that we're seeing on our TV screens every night these days. In fact, rotavirus was claiming over 500,000 children's lives every year. But it was no match for the impact that resulted when public and private sector forces came together. The solution started with the woman who discovered rotavirus, Ruth Bishop, and the epidemiologists like Roger Glass, Umesh Parashar, Joe Brzee, who shed light on what others didn't see. It continued with the academicians like Paul Offit, Fred Clark, Stanley Plotkin, Dick Ward, who created and tested the rotavirus vaccine. The private sector companies like Merck and GSK that prioritized the development that was required to turn that vaccine into a product, including studies of up to 70,000 infants. Then public health entities like the World Health Organization, the Advisory Committee on Immunization Practices, they recommended the vaccine. And philanthropic organizations and alliances, such as the Gates Foundation and Gavi, they funded further development and delivery, enough vaccine for all children globally, regardless of what village they were born in. The story ends with perhaps the most important heroes of all of the vaccine work, and that was the program workers and the healthcare providers on the ground. People like Dr. Juliana. She was the pediatrician that I rounded with on many days during my time in Kenya. Even if born in a poor village, babies now are starting life with a head start over their peers of just a decade ago. Because today there are 4 rotavirus vaccines that are pre-qualified by the World Health Organization. The impact has been enormous, with deaths from rotavirus cut by over half and still dropping. But perhaps there's no more clear depiction of the power of partners joining forces than the COVID-19 pandemic. Likely in just a matter of days now, the first doses of a safe and highly efficacious vaccine will be administered to our healthcare workers and our elders, only 11 months from the time the SARS-CoV-2 gene sequence was first published. 180 countries have come together through COVAX, half of which are self-financing, to ensure equitable access for the vaccines. The leading vaccines borrow from fields like oncology and gene therapy to employ RNA technology and adenovirus vectors. Academics, public health experts, business executives are working together hand in hand to stop this devastating pandemic. This virus is simply no match for the power of these partnerships. To say this is unprecedented is truly an understatement. But what matters now is that we capitalize on this never before seen collaboration. It's important that global partnerships become our future. We founded the Bill and Melinda Gates Medical Research Institute almost 3 years ago with the idea that we could catalyze the collision of tip of the spear science and talented scientists, and we could put them with some of the world's deadliest infectious diseases. The vision is to take advantage of the golden age of biotechnology that we're currently living in and build on the cutting edge technology that has brought amazing advances in cancer and autoimmune disease and gene therapy, and apply those and enable weapons against diseases that disproportionately affect those in low resource settings. The biggest risk that we have is one that my friend and colleague, Dr. Paul Farmer, said is a failure of imagination. Indeed, if we were tonight sitting at the Willard, I'd be looking out at all of the talented people seated in the room and asking, are we thinking big enough? If we set the goal to have new vaccines and therapeutics approved for malaria, TB, RSV, and Shigella in the next decade, is that soon enough? Bill Gates Sr. passed away this year in September. He often reminded those around him that we are all in this together. Understand and embrace the problem of others. Don't look away. Those numbers that you share, they're our neighbors. Yes, those daily statistics that we're seeing about COVID deaths, they're our neighbors. The 1 in 8 infants dying of diarrheal diseases and pneumonia, they're our neighbors. That dad in rural Kentucky who didn't die, he was a neighbor. There's nothing like a pandemic to remind us of our fragility, of our vulnerability to those pathogens that I once projected up on the wall. But there is nothing like a pandemic to remind us of just how vital, quite literally, it is that we work together. The public and private sectors unify, share, and partner to win this race, that we look at the numbers as our neighbors. On a personal note, to me, this award represents the work of many, many colleagues and mentors over the years. I'm so deeply humbled to share this honor with past award recipients, including the co-chairs of the Bill and Melinda Gates Foundation, and of course, President and Mrs. Carter. Wow. This award also represents my many teachers over the years. For Mrs. Howe, my 7th grade teacher who actually taught me what a blinded randomized trial was, to Dr. Mock, the pathologist who believed in me as a college student, and he showed me the path to medical school. And to my mentors at the University of Louisville, particularly Dr. Gary Marshall, who taught me how to design rigorous research, to deeply care about our patients, our neighbors, and to go out and contribute to the world. And in closing, I also want to thank my family for their patience and love, particularly my husband, Alan. I recall the story of my 4-year-old nephew who, after watching me on a TV segment about the rotavirus vaccine, burst into tears. His mother asked, "Nolan, what in the world is wrong?" His tearful reply, "But Mommy, where was Uncle Alan?" Now Nolan knows that Uncle Alan is here, even if you don't see him. He's right by my side, and without him and all of the Uncle Alans in the world, the work would not be possible. Friends, colleagues, mentors, distinguished guests, thank you. Let's join forces and partner together.